Yeah. So, okay. Yeah, now it works. Ah, yeah, no. So there is a spoiler for each slide. Huh? My name is Segolene. I'm the CEO and co-founder of Kantify, and I'm here today to speak to you about Zeptomix. It's a technology we developed for drug discovery. So we're not going to do a deep dive in drug discovery because it's we don't have time, but I would like to start with a figure which I hope you don't know personally, which is that 95% of diseases still not have a cure. So you may have personally or in your family have been confronted to that. There are people affected by cancers, rare diseases, cardiovascular diseases, and what they have in terms of option is super limited, which has an impact on their life and life expectancy. And in the 21st century, you may wonder if it's perhaps possible to do better. Why is it a problem? Because why is there this problem? Rather, it's drug discovery is expensive, super lengthy, and super risky. This is the issue. It's super expensive, between 2 and 3 billion US dollars to develop a drug. So you need to have a bit of cash. Between 12 and 14 years to develop a drug. And all these to reach a success rate of 2.5%. So there is a lot of investment for a result that is limited, and the risk is super high. So we use artificial intelligence to improve this. Drugs fail in clinical validations for different reasons. You can have a drug that works at a point in time in preclinical, and then when you test it on humans, it doesn't work. You can have a drug that works preclinical. When you test it on humans, they will have side effects, toxicity. You can put it to garbage. Other problems is that the drugs can have issues in the human body to be metabolized. So we use AI to do better. So we identify exactly what are the parts, the proteins in the body that can be targeted by a drug. It's super long to explain. Those of you who are in the field will understand. And beyond that, it's already a super big bottleneck to ensure that the drug will be efficient. And beyond that, we use AI to screen billions and billions of molecules in a few days, instead of doing it in a lab during months and years, to understand what is the molecule, what is the drug, which is going to have an impact on a specific disease. On a cancer, we work on rare diseases, we work on epilepsy, several indications. So the idea here is really to leverage technology, to leverage artificial intelligence, to speed up, de-risk, and make drug discovery extremely faster, cheaper, and less risky. We have collected millions and millions of data points, so we don't start from nothing. Our model is extremely well-trained. And to give you only one figure to understand the potential of artificial intelligence and of our technology especially, for a pharma company to find one molecule that is going to work, one possible drug, you need to test 100,000. With our technology, to find one molecule that is going to work, you need to test 3 molecules. 100,000, 3 molecules, and we have several results already in lab. So the change in terms of scale and speed and cost and risk is just like it's a new deal in drug discovery. It works not only on humans but also on plants because we have first results. So it's extremely promising. This is our team. We have bright colleagues. These are all of them with their smiles and personalities and talent. And we work with those people who are drug hunters, academia, working on really diseases for a lot of years, who were confronted to problems. They couldn't find anything. We come with our technology. Together, we join forces, and we have found already several drugs in many different diseases for which nothing had been found for years. This is what one of them is telling. Hallucinating, almost unbelievable, because he couldn't believe what he was seeing in his lab, because for years he had been looking for something. So it's extremely exciting, and I'm glad to share this progress with you. We are accelerating. We are moving quite fast in many different areas. And this is our pipeline. So it may sound strange because usually you see pharma companies who have pipelines of molecules, but we come from AI, and thanks to AI, we are building a pipeline of molecules, of drugs, in different therapeutic indications. And we believe this is very much the future, because with all these projects we have, we are managing to accelerate drug discovery at a really different pace. So AI for good, artificial intelligence is very hot these days. Many of us are doing AI. What we do is really improve human health with artificial intelligence, and I think it's a really exciting place and thing to do. Thank you very much for your attention.